Hello everyone, welcome to another episode of the next Saviours Essential Question Series for NEET PG 2025, where we are discussing the questions related to the medicine. And at least every year we will be able to see the question or find the question on neuromuscular disorder. So today we'll be talking about one question related to a neuromuscular disorder. What are the likely topics that are kept in NEET PG examinations related to this neuromuscular disorders are the Lambert-Eaton syndrome, the botulism, the polymyositis or dermatomyositis, the muscular dystrophies in the form of Duchenne-Becker, multiple sclerosis, Guillain-Barré syndrome. But all of you, as already are aware of the fact that myasthenia gravis is the most commonly asked question. So today we'll be talking myasthenia gravis as a prototype and would be discussing the four most common differential diagnosis related to this myasthenia gravis in a question in particular. So first of all, how to identify that the question is asked from the topic of neuromuscular disorders? You see, the muscle weakness would always be provided to you. Now it could be given in the form of a hint like proximal or distal or fluctuating kind of the muscle weakness. Reflex finding in the form of hyperreflexia, hyporeflexia or areflexia. Then sensory findings, that means no sensory abnormalities or sensory loss. And most importantly are the cranial nerve involvement in the form of diplopia, ptosis, the facial weakness, dysphagia, and so on. And finally, for conclusion of the diagnosis, they used to provide you in the question either the hydrophonium, the nerve stimulation, electromyography. These are the tests which are provided. So once you see all these findings in the question, then probably the question is asked from the neuromuscular disorder. So let's see the question first. A 32-year-old woman, as I told you that the question is asking, means we have kept myasthenia gravis as a prototype in this question, and the first line in itself is confusing to you or might confuse you, because all of you know that myasthenia gravis is more common in case of males, and that too after 60 years of age. But you see, it is also common in case of females, but in case of females less than 40 years, in case of males more than 60 years. So there is always a possibility that the examiner might give you the age group of less than 40 with a female as a prototype. Now presents to the neurology clinic with a complaint of progressive muscle weakness over the past 3 months. She reports that the weakness worsens as the day progresses and is especially prominent in the evening. So when you see these kind of the lines, you see, because you have gone through such questions so many times, by the time you reach this line, then the diagnosis is already over. But as I told you, we are here to discuss about the differential diagnosis and the key distinguishing features in between them. So she also experiences difficulty in keeping her eyelids open, and the speech becomes slurred after prolonged talking. Now she denies any sensory symptoms, the bowel or bladder involvement, or the recent viral illnesses. You see, all these findings are provided in order to rule the other options out. As you know, viral illness or recent food poisoning, it could be a history which is pointing towards the botulism. There is no fever, weight loss, or systemic illness. And as far as the vital signs are concerned, these are absolutely normal. Now, on the neurological examination, because after this, there is going to be a provision of the neurological examination. Now, when you examine the cranial nerves, there will be a bilateral ptosis where there is a worsening with sustained upward gaze for more than 30 seconds. Then, apart from this, there will be diplopia on prolonged lateral gaze, but specifically there is no pupillary involvement, and you will come to know how this finding is so very much important. Apart from this, there will be motor system involvement, symmetrical proximal limb weakness, that means arms more than legs. Weakness increases with repetitive movement, and deep tendon reflexes are absolutely normal, and there is no sensory or coordination abnormality. Now, for conclusion, that means in order to mark the answer, there will be a repetitive nerve stimulation test that showed decremental response. That means there will be more than 10% reduction in the muscle action potential amplitude. And the serum testing is positive for anti-acetylcholine receptors. So all these findings, on the basis of which you have already confirmed the diagnosis that it is myasthenia gravis. But as I told you, we are here to discuss the basic differences, that why is it not LEMS, why is it not botulism, why is it not the multiple sclerosis. You see, one thing, as you know about the myasthenia gravis, that it is a progressive fatigue muscle weakness which is particularly affecting the ocular muscles, resulting in ptosis and diplopia. There will be bulbar involvement leading to dysarthria. There will be proximal muscle weakness with worsening symptoms on sustained activity. Now, this pattern is classic for myasthenia gravis, which is an autoimmune neuromuscular junction disorder which is caused by antibodies against the acetylcholine receptors, as you already know, at the presynaptic membrane. So, what are the key findings which are present in the question? These are fluctuating weaknesses, which you obviously know that worsens with the activity. That means there is fatigability. Then there will be ptosis and diplopia without pupillary involvement, because myasthenia gravis, they spare the pupillary involvement. Weakness of the proximal limb muscles, more than that means arms are more commonly affected compared to the legs, or more affected compared to legs. Now, no autonomic dysfunction, which is present in case of Lambert-Eaton syndrome. Now, normal deep tendon reflexes, because in case of Lambert-Eaton syndrome, again, the deep tendon reflexes are found to be reduced, and repetitive nerve stimulation test shows a decremental response, which is a hallmark of myasthenia gravis. And in order to confirm the diagnosis, you are having a serum anti-AChR antibody positivity. All right. Now, one thing that you already are missing, because as a NEET PG aspirant, you all have heard about this edrophonium or the tensile test, which is not provided to you in the question. Why have we not kept this edrophonium test in the question? Because the examiner obviously know that when you see edrophonium test in the question, then two things comes into your mind. One is myasthenia gravis, or it could be cholinergic crisis. That is why we have kept edrophonium test out of the context. But if at all you want to know what the edrophonium test is, then you know edrophonium, which is responsible for inhibiting the acetylcholinesterase. That means it increases the acetylcholine availability at the neuromuscular junction. And as you know that in case of myasthenia gravis, where acetylcholine receptors are blocked by autoantibodies, so temporarily increasing the ACH level improve the neuromuscular transmission. As a result of it, there will be rapid temporary improvement in the muscle weakness, like ptosis will be improved, it will be resolved within seconds. So this is the finding for edrophonium test. But in case if there is worsening of the symptoms, that then this thing indicates the cholinergic crisis. So that is all about edrophonium test, which we have not kept in the question related to the myasthenia gravis in this discussion. Okay. Now coming on to the important part, that why this question, answer for this question was not Lambert-Eaton myasthenic syndrome. A very important point is that, Lambert-Eaton syndrome is a presynaptic disorder. So auto antibodies against voltage gated calcium channels are there, which impairs acetylcholine release. So here the symptoms, they improve with the repeated use. That means there is no decremental response on RNS. There is incremental response on the RNS. So this is finding which is exactly opposite to what we see in myasthenia gravis. On the other hand, there will be a weakness which is affecting the lower limbs more than the upper limb, which is again exactly opposite to myasthenia gravis. The deep tendon reflexes are found to be reduced, which is normal in case of myasthenia gravis. Now, autonomic dysfunction is present, like there will be dry mouth, there will be erectile dysfunction, but these autonomic dysfunctions are absolutely normal in case of myasthenia, and they are strongly found to be associated with small cell lung cancer. And if the examiner decides to give you a question on Lambert-Eaton syndrome, then they probably will give you this as a clinical feature. Then another point is that why it is not botulism. As you already know that botulism is caused by Clostridium botulinum toxin, which is responsible for inhibiting the ACH release at the presynaptic junction. So what happens in case of botulism is that there is a descending paralysis which starts with the cranial nerve, then affects the limb. So there is a descending paralysis. Now, prominent autonomic symptoms are there. Respiratory involvement occurs early, and history of ingestion of contaminated food, that means food poisoning, history would have been provided in the question had the examiner asking about botulism, right? So that is the reason why botulism is not the correct answer related to this particular question also. Then why is it not multiple sclerosis? Another option. You see, multiple sclerosis is a central nervous system demyelinating disorder. So the symptoms over here includes the sensory loss, the ataxia, the spasticity, which is obviously not seen in case of myasthenia gravis. As far as episodes are concerned, they are relapsing remitting, so they are not fluctuating throughout the day. Relapsing limiting means one time there is a spasticity, the other time it is absolutely normal. Then if a question was given related to this multiple sclerosis, then they might have provided to you the MRI finding, which shows demyelinating plaques, which is also known by the name of Dawson's fingers, and the CSF shows the oligoclonal bands, which is obviously not there in the question related to the myasthenia gravis. As far as repetitive nerve stimulation test is concerned, it is absolutely normal in case of multiple sclerosis. So this is the reason why all these three differential diagnoses are not the answer for that prototype question that we have kept. I know what you want at this point of time is that what about the other neuromuscular disorder? How to identify these neuromuscular disorder? For that, it requires an approach. So that approach to the questions which are related to the neuromuscular disorder would be discussed tomorrow. So till then, keep yourself updated, keep yourself happy, keep yourself focused, and join our Telegram group so that you do not miss any important update related to this NEET PG 2025 examination. Thank you very much.